What I'm about to tell you might upset you. It might even make you angry because there's a very high chance your doctor is using the wrong blood sugar targets for your age, not because your doctor is careless, not because they don't want to help you, but because most medical guidelines still treat a 35-year-old and an 80-year-old exactly the same. Same numbers, same targets, same medications. And for seniors, that approach can be dangerous, sometimes deadly. New research shows something shocking. For older adults, blood sugar that's too low causes more harm than blood sugar that's slightly higher. More falls, confusion, broken bones, ER visits, car accidents, hospitalizations, even deaths. All from trying to hit perfect numbers. I'm Dr. Claire Whitmore. And after more than 20 years working with diabetic heart patients, I've seen this mistake destroy lives again and again. Not high blood sugar, not complications, but overtreatment. Doctors chasing perfect lab results while their patients feel terrible, weak, shaky, afraid to be alone. Today, I'm going to show you why tight control is dangerous after 70. The 5 false beliefs doctors still follow. The 6 warning signs you're being overtreated, and the exact age-specific blood sugar targets that research now recommends. But before we talk about numbers, you need to hear Harold's story. Because what happened to him should never happen to anyone. Harold's story. Harold was 78 years old, diabetic for 12 years, quiet, responsible, followed every rule his doctor gave him. His doctor kept saying, "Your numbers are perfect. We want your fasting under 100. A1C under 6.5, that's excellent control." And on paper, he looked amazing. Fasting sugar, 95. A1C, 6.3. His doctor was proud, but Harold felt awful, constantly tired, shaky, sometimes confused. At night, he'd wake up sweating and disoriented. His wife, Ellen, would check his sugar. Dangerously low, she'd rush for juice, sit with him until he could think clearly again. At first, it happened once a month, then once a week, then 3 times a week. Harold told his doctor, "Maybe just eat a snack before bed," the doctor said. "But your A1C is beautiful. We don't want to lose this control." Beautiful. That word haunted Harold because beautiful numbers were ruining his life. Then one afternoon it happened while driving. Hands shaking, vision blurry, mind foggy. He tried to open glucose tablets, couldn't. Next thing he remembered, he woke up in the ER. Broken arm, broken ribs, concussion. His blood sugar when he arrived? He had passed out and crashed into another car. The other driver was injured too. All because his blood sugar was too low. Not too high. Too low. The endocrinologist who saw him said something Harold will never forget. For someone your age, an A1C of 6.3 isn't excellent. It's dangerous. Dangerous. She changed his targets immediately. Fasting, 110, 130. A1C, around 7.58. Within weeks, no more lows, no more fear, no more night emergencies. Harold didn't need tighter control. He needed safer control. And here's the terrifying part. His doctor wasn't doing anything unusual. They were following standard guidelines, which means this is happening everywhere, every day, to thousands of seniors. Before I show you the exact blood sugar targets you should actually aim for, you need to understand something first. Because if you don't, you might walk into your doctor's office with this information, and they'll dismiss you in 30 seconds. Not because they don't care, but because they've been trained to believe 5 ideas about diabetes that sound logical, yet become dangerous after 70. These beliefs are repeated in medical school, in guidelines, in conferences for decades, and they're so deeply ingrained that many doctors never question them, even when patients like Harold end up in the emergency room. Let's break them down one by one, because once you see these clearly, you'll never look at tight control the same way again. False belief, or 5. Lower blood sugar is always better. This is the most common sentence you'll hear. The lower we keep your sugar, the better. Sounds reasonable, right? Less sugar, fewer complications. That's what we've all been taught. And for younger adults, it's mostly true. If you're 35, you have 30 or 40 years ahead of you. You want to prevent kidney failure, blindness, nerve damage. Those take decades to develop. So tight control makes sense. But here's the problem no one explains. If you're 75 or 80, you're not trying to prevent something that might happen 25 years from now. You're trying to stay safe today. And low blood sugar doesn't cause problems in 20 years. It causes problems in 20 minutes. Falls, confusion, passing out, car crashes, broken hips, brain injury, those happen immediately. So the risk calculation flips completely. For seniors, high sugar, slow, long-term risk, low sugar, immediate life-threatening risk. Yet doctors still chase low numbers because they were trained that lower is always better. But after 70, lower is often worse, much worse. False belief. 4. Preventing future complications is always the top priority. Let me ask you something. If someone is 82, does it make sense to aggressively treat today to prevent a complication that usually appears in 20 years? Probably not, but that's exactly what happens. Doctors are trained to think, prevent kidney disease at all costs, prevent blindness at all costs. But what if the cost is constant hypoglycemia, falls, hospital stays, losing independence? What if someone breaks a hip next month? Because we were trying to prevent eye disease in 2045? That's backwards. For older adults, priorities change. It's not perfect labs. It's stay steady, stay safe, stay independent. Living well today matters more than chasing perfect numbers for a future you may never face. False belief number 3. A1C tells the whole story. This one fools almost everyone because A1C looks so scientific, so precise. 6.4, 6.7, 7.1 feels like a grade in school. Lower must mean better, right? Wrong. A1C is just an average, and averages can lie. Imagine this. Morning, 200. Afternoon, 45. Evening, 189, 50. Average looks normal. But those 45s and 50s? Those can kill you. The A1C hides the danger. This is exactly what happened to Harold. His A1C was perfect, but he was crashing 3 times a week. A perfect average nearly cost him his life. For seniors, stable is more important than low. An A1C of 7.5 with no lows is far safer than 6.3 with constant crashes. But many doctors only see the number, not how you feel, not what you're experiencing, just the lab result. And that's where overtreatment begins. False belief for 2. The same medications are safe at every age. Here's something most people don't know. Your kidneys naturally slow down with age. It's normal. By 75 or 80, medications stay in your system longer, which means the same dose you took safely at 50 might be too strong at 80. But many prescriptions never change. Same insulin, same sulfonylureas, same doses. These drugs don't gently lower sugar, they force it down, even when it's already low. So older adults are much more likely to experience sudden drops, confusion, fainting. Yet treatment plans often look identical to those for younger people, which makes no physiological sense. Different body, different metabolism, different risk, but same drugs. That's a recipe for hypoglycemia. False belief number 1, numbers matter more than how you feel. This is the most dangerous one, and the saddest, because it turns medicine into math. Doctor sees A1C, Sigrahat, 6.4. Great job. Meanwhile, you feel exhausted, weak, scared to be alone, eating every 2 hours to avoid crashes. But the numbers look good, so your suffering gets ignored. This is backwards. If your good numbers make you miserable, they're not good numbers. If your perfect control puts you at risk of falling, it's not perfect. If treatment destroys your quality of life, it's wrong. Period. Medicine should serve the patient, not the spreadsheet. And when you combine all 5 beliefs, this is what happens. Doctors chase lower, push medications, celebrate low, A1C, ignore symptoms, and accidentally overtreat seniors, which leads exactly to stories like Harold's. And here's the scary part. Many people watching right now are probably being overtreated and don't even realize it because the warning signs feel normal. Just aging, just diabetes, just getting older. But they're not normal, they're red flags. In the next part, I'm going to show you the 6 clear signs your blood sugar targets are too strict. If you recognize even one of the, so now you understand the problem. It's not that your doctor doesn't care. It's not that you're doing something wrong. It's that the entire system was built around younger adults. And those same rules are being applied to bodies that work very differently after 70. And here's what worries me most. Many older adults are being overtreated right now, but they don't realize it because the symptoms feel subtle. They blame aging. They say things like, I guess I'm just getting weaker. I guess this is normal at my age. I guess diabetes just makes you tired. But often, those aren't signs of aging. They're signs your blood sugar is being pushed too low. Let me show you exactly what to watch for. Because if even one of these sounds familiar, it may be time to rethink your targets. Sign number 6, frequent low readings. If your blood sugar drops below 70 more than once or twice a month, I recommend paying close attention. Because that's not good control. That's instability. And instability is what causes accidents. You shouldn't need emergency snacks regularly. You shouldn't have to carry juice everywhere. You shouldn't feel shaky or confused during the week. Those are signals your body is under stress. For older adults, prevention of lows is far more important than chasing perfect numbers. Stable always beats low. Sign number 5, unexplained falls or near falls. This one is extremely common and rarely connected to blood sugar. You stand up, feel lightheaded, lose balance, or suddenly feel weak. Most people think, my legs are just weaker now, but very often, it's glucose dropping. Even a small drop can affect coordination and reaction time. And for seniors, one fall can change everything. Not because the fall is dramatic, but because recovery takes longer. Independence becomes harder. So if falls are happening more often, I recommend checking your glucose at those moments. The answer might surprise you. Sign number 4, brain fog or memory slips. If your thinking feels cloudy, if you feel confused sometimes for no clear reason, if you walk into a room and forget why you're there, many people assume it's simply aging. But your brain runs on glucose. Too low for too long, your brain struggles. And repeated lows may affect concentration and clarity. I'm not saying every memory issue is blood sugar, but if symptoms started after tighter control or medication increases, it's worth discussing. Sometimes just relaxing targets slightly brings surprising mental clarity back. Sign number 3, constant snacking to prevent crashes. If you feel like you must eat every 2-3 hours, not because you're hungry, but because you're afraid of dropping, that's not balance. That's survival mode. Good diabetes management shouldn't feel like you're constantly fighting lows. If you're planning your entire day around preventing crashes, the treatment may be too aggressive. Your body shouldn't need rescue food all the time. Sign number 2, feeling terrible despite perfect numbers. This one breaks my heart because I see it constantly. People show me beautiful lab results and say quietly, but I feel awful. Low energy, weakness, anxiety, no confidence leaving the house. If control makes you feel worse instead of better, something is wrong. Health should feel like freedom, not fear. Numbers that look perfect but make you miserable? Those numbers are not helping you. Sign number 1, needing others to watch over you. If your spouse checks you at night, if family worries about leaving you alone, if someone keeps juice beside your bed, that's not independence, that's risk management. And it's often caused by overly tight control. At this stage of life, the goal isn't perfection, it's safety, calm, confidence. Being able to live your day without fear. If you recognized even one of these signs, I gently recommend having a conversation with your doctor. Not a confrontation, a conversation. Because now, let's talk about what your targets could look like instead. Age-appropriate blood sugar targets. These are based on geriatric and diabetes guidelines, not my personal opinion. And remember, these are ranges, not rigid rules. They should always be individualized. Healthy adults, 65-75, active independent. Few medical issues I typically recommend discussing. Fasting, 90-130. Before meals, 90-130. Bedtime, 110-150. A1C, around 7.0-7.5, still controlled, but less aggressive than young adults. Adults 75-85 with some conditions. This is where many viewers fall, and where overtreatment happens most. I usually suggest discussing fasting, 100-140, before meals, 100-140, bedtime, 120-160, A1C, 7.5-8.0. Notice something important. These numbers are slightly higher, but much safer, because they dramatically reduce hypoglycemia risk. And for this age group, safety matters more than perfection. Frail adults 85 plus or complex health. Here, comfort and stability matter most. Targets may be fasting, 110-150, bedtime, up to 180, A1C, 8.0, 9.0. Not because we gave up, but because avoiding lows becomes the top priority. There's no benefit to pushing aggressively at this stage, only risk. How to talk to your doctor. Here's what I recommend saying. I've been having some low episodes and feeling unsteady. I read that older adults often use slightly higher targets for safety. Could we review whether my goals are appropriate for my age? Notice the tone. Curious, collaborative, not confrontational. Doctors respond much better when you work together. Bring logs, bring examples, show patterns. Data helps everyone make better decisions. And before we finish, I want to leave you with one simple thought. Managing diabetes after 70 isn't about chasing perfect numbers. It's about living well, walking confidently, sleeping peacefully, feeling steady, staying independent. If slightly higher numbers give you that life, that's not failure, that's success. In the next video, I'm going to talk about one specific diabetes medication that many seniors still take, even though it frequently causes lows. And I'll explain safer alternatives you can discuss with your doctor. So make sure you're subscribed, because small changes like these can make an enormous difference in how you